you. Well, a doctor's biggest competition used to be Dr. Google, but Dr. TikTok is slowly creeping up to #1. It seems like every other week influencers say they have discovered some type of health hack out there.
Yeah, but the real doctors say be careful who you listen to. Dr. Ken Redcross is the author of Bond, the 4 cornerstones of a lasting and caring relationship with your doctor, and he joins us now with the wellness hacks to stay away from and some that may actually work. So thank you for being here.
Thank you guys, because now we have to get TikTok Doc. We were dealing with Dr. Google and TikTok Doc. The issue is
it's something different.
It's something different. Whole different animal, right? Because they're actually doing medicine. But I'm here to tell you, you know me, I'm a positive guy.
Okay.
So we need to just pull out some good things that are good for us, and that's the key.
So let's talk about that. Are some of these social media trends harmful, or you said they could be kind of good?
You know, that's the hard part, right? Because I like where it's coming from, because we're talking about health things. Like some of the things we'll mention today, we never would have talked about if we didn't have TikTok. But you have to make sure that you do what? Go back to your doctor. It's key.
Ask the expert.
Don't just go back to Dr. Google, right?
No,
right?
try not to do that.
You can't go from one to the other. All right, so let's start with one of the latest trends. It's a dietary supplement that people are calling Nature's Ozempic. So what is it and what does it do?
Now, this is a beautiful thing here. So this is the positivity of TikTok. Now we're talking about berberine, which is a natural ingredient, which is great. Berberine is good for blood sugar support, for cholesterol support. Ozempic is for diabetes and also for sugar as well. But berberine got roped into there, but now we know about the benefits of something that's a little bit closer to the earth. The weight loss benefits. You don't get so much with berberine. Now, there is some data that shows it could help with waist circumference, which is important. But the point is, remember 2 things, cholesterol and blood sugar with that. And so Ozempic kind of skewed that a little bit.
Yeah, it sure did, right?
So you said that we don't actually get the weight loss benefits with berberine.
Not so much with berberine, but there are some studies that are showing there's some promise. But I just want everybody to focus on the 2 important things that's affecting the world, blood sugar and then cholesterol right behind it.
Oh, gosh, it sure is right. All right, let's talk about a couple of other trends out there, because there are so many. The Hot Girl Walk Challenge. That doesn't sound like a bad thing.
Not to be confused with Hot Girl Summer, because I know about that one. But
I do too. I'm an 80s kid. I know about that. So the point is here, the Hot Girl Challenge or the Hot Girl Walk Challenge is a good one. And it's interesting because you're thinking, well, what's the big deal, Doc? You know, she's telling us to walk. I love what she's doing. She's focusing. She's making sure that you're saying positive things. And above all, you're reminding yourself of how hot you are. Very good thing. But sometimes I don't want my patients to necessarily go out and walk too far. Is their footwear okay? Are they older? Should they kind of let me know what the regimen is? So once again, come back to us before you just run and do it.
Right, right.
Okay. So something that can help you on that Hot Girl Walk Challenge, water intake and staying hydrated. But there's something called chugging. Why is that dangerous?
All right, so look, guys, the chugging challenge, once again, you think, well, what's the big deal with water? Well, our body doesn't like huge volumes of water at one time. It brings down our sodium, which can be devastating. Now, how much water should we get? Always say 8 cups, 8 times a day. But once again, you have to talk to the doc, because there's some of my patients who have heart disease where I don't want them to get that much liquid throughout the day. So even if it's a water challenge or walking, talk to the doc first to make sure that it fits you.
Because everything is so individualized. I mean, that's the big thing, and that's the problem with some of these, is that it's just kind of these blanket statements overall. Okay, so let's see, what else we have? Oh, we have the box breathing challenge.
Now,
how does that help? Can that help with anxiety? Because we'll take that.
Exactly. Everyone's like, let me listen in, Doc. The key here is box breathing, guys. This is pretty much focusing on your breathing, gives you a focal point. This is a good challenge here, right? Because you're doing this deep breathing. You're going to hold it. You're going to breathe out, hold again. The only issue here is that if you find yourself box breathing all day long, you need to call me. Because there's an issue.
You need more than TikTok.
We need more than TikTok. Because then I need to know, look, are we dealing with an anxiety disorder? Are we dealing with depression that's kind of changing the corner? So once again, it's a good one. And all these TikTok things are things that we can cherry pick, but you have to mesh it with the doctor as well to make sure.
I like what you said, though. I like we're talking about them, period.
Absolutely.
You know?
I think we did the box breathing because they were saying that Navy SEALs actually do that in their training.
Perfect thing.
Right.
So when you're talking about that, I love that, because the Navy SEALs also talk about obviously eating healthy and the things that we're talking about. So that box breathing is a big, big part of everything. And so when you're looking at the supplements, when you're looking at these things, remember, even when I mentioned berberine and so forth, talk to your doc to make sure there's a good fit.
Talk to the doc.
For sure. That's why we got you here.
Thank you.
All right. Well, Dr. Redcross, thank you for joining us.
Oh, thank you for having me on. Be well, everybody.
Yes, and for more health tips, you can follow Dr. Redcross on Instagram at Dr. Ken Redcross. What a name.
Yeah, I love it.
All right, the lines for back to school.